essentially, the government of Venezuela, led by President Nicolas Maduro, is not recognized by the US. The US recognizes another person as the president of Venezuela. So apparently there is a dispute in terms of whether the government of Venezuela, led by Nicolas Maduro, can actually access funds to pay COVAX to get the first distribution of COVID vaccines from that program for Venezuela. So according to Nicolas Maduro, the US doesn't allow him to access those funds, and according to the president recognized by the US, Nicolas Maduro has not requested access for those funds. So the bottom line is that what is happening in Venezuela is very much the outcome of how political the pandemic has become, and how, unfortunately, leaders in different parts of the world, including Latin America, are using it as an excuse to advance their own political agendas. Having said that, I think it is important for your audience to understand that COVAX, as well intended as it is, even if it worked perfectly well, it would only be able to supply up to 20% of the demand that is needed in the world for the vaccine. So in the case of Venezuela, it is also important to understand that apparently, and I say apparently because the official figures are not always that reliable, but apparently the country has not been strongly affected by the COVID pandemic compared to other countries in Latin America. So I really think that what is happening in Latin America is very much a political dispute that unfortunately is going to affect mostly the poorest people in the country, and not the politicians having those discussions.
And that's really the ironic thing about it, because the whole point of COVAX was that it was supposed to help support those in low and middle income countries get access to the vaccine. So then, is this any sort of alternative for Venezuelans if they can't work out this political dispute over vaccines?
So they are in very close consultations with Russia to get access to the Sputnik vaccine. They are in consultations with China, and they're also in consultations with Cuba to get access to different vaccines. My understanding is that the plan right now in Venezuela is really to start until April with more massive vaccination efforts. We'll see how it goes. Fortunately, the country has not been as affected as others, but obviously they have cases. And the public health infrastructure in Venezuela has been decimated as a result of the major political, social, and economic crisis that the country has been facing for several years now.
So then, as you look at the region as a whole, how important is the COVAX mechanism there?
I think in principle it is important because it brought countries from many different parts of the world together. I think in principle it's important because it gave a little bit of a chance to higher income countries to really share their wealth a little bit and help ramp up the production of vaccines globally, with the idea that they would pay much more for those vaccines when they are available compared to lower income countries. But in reality, what has happened, Rachel, globally, is that high income countries have captured the vast majority of vaccines. Some of the high income countries are even getting access to COVAX vaccines that they were not supposed to be getting access to. So there is a lot of hoarding that is happening with the vaccines in high-income countries. And as we know, there are many low-income countries in the world right now where not a single person has been vaccinated at a time where, over 40 million people have already been vaccinated in high-income countries. So in principle, it's a fantastic idea. It's a great idea. It's with the strong involvement of the World Health Organization, which is, whether some people like it or not, it is the only international body that really has the experience and the capacity to run such a massive global vaccination program as they have done for previous pandemics. I think it's important also to understand that what is happening right now in regard to the huge inequities on distributions of vaccine is not going to do good to anyone, because the pandemic will not end globally until all the people in the world have access to, all the countries in the world have access to this vaccine.